What is an HSG and can it help you get pregnant? Hi everyone, I'm Dr. Babahani. I'm a board-certified reproductive endocrinology and infertility specialist as well as a minimally invasive GYN surgeon, and you're watching the Fem Health channel. Let's talk about a very important test that's usually done in the early part of the trying to conceive journey when trying to get pregnant naturally is not working. So what is an HSG? An HSG is short for Hysterosalpingogram. It is a specialized X-ray procedure that allows doctors to examine the inside of a woman's uterus and fallopian tubes. This test is often recommended for women who are experiencing difficulty getting pregnant, as it helps identify physical issues that may interfere with fertility. By using a special contrast dye and real-time X-ray imaging, an HSG provides a clear picture of whether the fallopian tubes are open or blocked, and whether the shape of the uterine cavity is normal. During the procedure, a thin, flexible tube called a catheter is carefully inserted through the cervix into the uterus. Once in place, contrast dye is slowly injected through the tube. As the dye fills the uterus and flows through the fallopian tube, a series of X-ray images are taken. These images allow the doctor to see the shape of the uterus and track the path of the dye, which should normally travel through the tubes and spill out into the abdominal cavity if the tubes are open and functioning correctly. The entire process typically takes between 10 to 30 minutes and is usually performed in a radiology department, fertility clinic, or sometimes outpatient surgery centers. An HSG is a valuable diagnostic tool because it can detect several conditions that may prevent pregnancy. For example, it can reveal whether or not both tubes are blocked, preventing the eggs from reaching the sperm. It can also detect scarring inside the uterus, which may have developed from infections or previous surgeries. Additionally, the test can identify structural abnormalities of the uterus, including congenital malformations, such as a septate uterus, as well as fibroids or polyps that may distort the uterine cavity and interfere with embryo implantation. Although an HSG is primarily used as a diagnostic test, some women do experience an unexpected benefit, which is an increased chance of pregnancy in the months following the procedure. In fact, research has shown that some women conceive naturally within a few months after having an HSG. This may be because the contrast dye, particularly when oil-based, can sometimes clear minor blockages, such as small mucus plugs or debris in the fallopian tubes. By flushing out these obstructions, the HSG may temporarily improve the chances of the egg and the sperm meeting, which is essential for natural conception. However, this effect is usually observed in cases where the tubes are only partially blocked or narrowed, rather than completely obstructed. But what if your fallopian tubes are totally blocked on the HSG study? So if the HSG reveals that both fallopian tubes are truly blocked, natural conception would be highly unlikely without medical intervention. In such cases, fertility specialists may recommend moving forward with advanced reproductive treatments such as IVF, which bypasses the fallopian tubes entirely by fertilizing eggs in a laboratory and transferring embryos directly into the uterus. Understandably, many women are concerned about whether the procedure is painful. While an HSG is generally safe and quick, it can cause discomfort and cramping, especially when the dye is injected into the uterus. The sensation is often compared to intense menstrual cramps, but the discomfort typically lasts only a few minutes and subsides shortly after the procedure is completed. Some women may also feel pressure during the placement of the catheter. To minimize discomfort, doctors often recommend taking an over-the-counter pain reliever, such as ibuprofen, about an hour before the procedure. After the procedure, light spotting or mild cramping is expected and may continue for a short period. Most women are able to resume normal activities, though, later that same day. Ultimately, an HSG is an essential test for many women facing infertility because it provides critical information about the health of the reproductive tract. By revealing whether the fallopian tubes are open and the uterus is free of abnormalities, an HSG can guide doctors in creating an effective treatment plan tailored to a woman's specific fertility challenges. Although it is not guaranteed to improve fertility, some women do experience spontaneous pregnancies after an HSG, making it a procedure that can serve both diagnostic and therapeutic purposes. For women who are struggling to conceive, discussing an HSG with a fertility specialist can be an important next step. Hope you found this helpful, and remember to subscribe below, and we will see you in the next video.